Hi, it's Dr. Ruth, the Pain Doc, founder of Chronic Pain Rescue, a telehealth practice devoted to helping those who suffer from chronic pain to live pain-free or at least significantly pain-less, using holistic and integrative approaches. We're expecting a guest today. She's located in one of my favorite places in the world in Hawaii. She does regenerative medicine plus many other things. I'm not certain that she's coming on. I'm hoping that she is. This was the time she selected, but we've just had some issues connecting this week. But I figured, you know what? To me, this topic is important today. I didn't want to just leave it blank. And maybe if she doesn't make it today, maybe we can always reschedule again and visit with it. But the topic today, regenerative medicine, can it help your pain? I plan to ask her, what is regenerative medicine? I don't necessarily practice it. I've been to workshops. I've watched it performed. But I do think that if you're not aware of it, it may be something to explore. Explore with your doctor, explore with your surgeon, explore with your pain management doctor. Basically, they're able to take stem cells. They're sort of like newborn cells. They're not designated into anything. They haven't become skin or bone or tendon or ligament as yet. So they're nascent cells, and when you place them in a place of injury, you inject them, they can become those areas to take on and develop into the types of cells that are needed in that area to repair that tendon or repair that cartilage or repair that that tendon. So pretty amazing stuff. I plan to ask her this. Somebody that says, oh, just give me surgery. My knee's killing me. My hip is killing me. I just want a replacement and just be done. And this may prevent that or significantly delay that, the need for that. And why would that be important? A good reason is that there's lots of risk with surgery. Anytime you have surgery, even if the doctor has done it, thousands of times, there's always risk with every surgery. So it's not something that you take lightly, that you run into without exploring all possible avenues of relieving your pain without having to have surgery. Now, as I said, I'm no expert in regenerative medicine. It fascinates me. I think it is an awesome alternative because, first of all, it's natural. It's coming from your own body, right? So we're not injecting anything into you that's not already yours, and it just promotes a natural healing process. So people use it for arthritis. They use it for torn tendons, torn ligaments, labral tears, and all manner of things where joints or thereabout need repair. There are three, what I do know, is just a little bit, there are three ways they can harvest these cells. First off is using the blood. They draw blood from you and they'll centrifuge it down, and eventually they're getting those stem cells. I think it's usually platelets, but there's stem cells, and then they will put it in a type of a process so that it can be injected back, into that area. Maybe it's your knee, maybe it's your shoulder, where it needs to go. But they can also harvest from fatty tissue. Now, as I said, I don't practice it, so you would need to speak with someone who does as to, when do they decide to do fatty tissue. I do know that the blood is the first place, but perhaps when that's no longer as helpful, they will go to getting it from fatty tissue, which is a different source, and there may be different reasons for that source. As I said, I don't practice it myself, but I do know that they can do that. And the third place they can harvest these stem cells is from bone. Not a pleasant thing, right? Because they're going into the bone and taking out particles from that. But again, that's in a more extreme situation. Sometimes they'll mix the two, because they're looking to treat, uh, and more is needed than just what they would get from the blood. So as I said, I'm not sure that she's coming. We may have to have her come another time. Uh, I am here ready to work with anyone who is willing to put themselves to work to get rid of their pain. Um, there are ways to help your pain, and it may not be as difficult as you think. It may not just be about a pill and getting the right medication. It really may involve, if you're willing, lifestyle changes. What foods are you eating? What drinks are you drinking? Are you learning how to calm your system so that you're not stressing out and having more pain? How to move, how to get back your life. What would your life be if you didn't have the pain? That's where I want to get you to, is how will you be when we get to the other side of this pain and you have your life back and you can do whatever it is that's on your heart to do? I want to help get you there. I'm Dr. Ruth the Pain Doc. You can find me on social media at Chronic Pain Rescue, my website, www.chronicpainrescue.com. You can make a 30-minute free consultation if you want to explore whether I'm someone that you'd want to work with, or if you're already convinced, go to my website, go to my social media page, and let's get it started. Okay. Until next time, peace and blessings.